Okay, well, welcome. My name is Brooke Tippins. I am the Director of Community Affairs here at University Hospital, and we're so excited to see you today. First of all, thank you for your patience this morning. We know we are a little delayed, but when you're the first community-based health center for University Hospital, we are so excited to have this event. I am going to bring up our President and CEO of University Hospital, Ed Jimenez.
Thank you, Brooke. Welcome to all of you. Thank you for being here. We have so many distinguished members of the community here to celebrate with us. Brooke alluded to this, and I think it's worth repeating over and over. Since the 70s, University Hospital has taken seriously the commitment to serve the community. And since the 70s, we've done it really, really well from over there. This is the first step towards getting further into the community. This is our first step in saying that we've heard you loud and clear, that the community needs us more accessible in facilities that are more meaningful, more patient-centric. I think our staff are going to love this new building. And so as we think about where university goes, it goes from doing what it does well, meeting the needs of the community, but now doing it in a way that's closer, more meaningful to community members. Today you'll hear from a lot of people. The list is long of those that supported us getting here. The journey's been quite long. It started in the pandemic, actually prior to the pandemic, and the pandemic obviously caused a lot of different time changes for everybody. But that didn't stop this project from going forward. We're beneficiaries of a great idea that allows us to be tenants in this building. And so there's a landlord that's organized all this. It's our job to then come inside and make sure that the great medical care and the great community service that we're supposed to do is done every single day. From members of our government to members of the community, the steps have been long and large. But I think as you walk around here, you'll be proud of what's come together. And so, at the risk of making this a super long conversation today, I'm going to finish my remarks. We have many folks that will speak, and as they speak, they're here because they care about the community primarily, and they're long supporters of University Hospital. So when we're done, please tour the facility. Please enjoy some refreshments. Please tell everybody you know to come here to get great medical care. So thank you.
Thank you, Ed. So of course, a project like this could not work without some funding. So we have to have next up Melody Walter from NJMFA. Thank you so much. I'm glad you could make it in.
Thank you so much. Good morning, everyone. HMFA started to work with anchor institutions and partners in the community a few years ago because there's been a tremendous amount of research that has shown that, in short, the community knows what it needs. Hospitals know how to make people better, and developers know how to build housing, and all three of them need to be talking to each other to make projects work that are really going to be beneficial to supporting the health and wellness of residents. As critical anchor institutions in their communities, hospitals become perfect partners for the development of local affordable housing because they already have a reach to the community, they already have partners in the community, but they need space to operate effectively within the community and with their neighbors. When NJHMFA began the Hospital Partnership Subsidy Program in 2019, the agency was out all over the state saying, housing is healthcare. And it came down to a numbers game initially, showing that you can save hundreds of thousands of dollars as a hospital by investing in people for preventative care, by investing in community wellness, better food, access for schools, all of these things that help to create a stronger, more resilient community, and then reduce ER utilization. So it goes to this idea that when you can produce that kind of margin, you can advance the mission further than you ever could just on good ideas or belief. So we worked really hard to try to pull those elements together. And today's achievement, which is the opening of the Health and Wellness Center, is a clear example of the commitment to Newark residents and the link between housing and healthcare here and across New Jersey. This project sets aside 8,000 square feet on the ground floor to provide preventative and primary care through the Health and Wellness Center. This center offers services including wellness and preventative care, women's health care, diabetes management, lab work, and point-of-care testing. It augments University Hospital's ability to provide social services by providing outpatient medical and supportive care that aligns with their mission. Perhaps most importantly, the residents of the community were able to weigh in to talk about the way to shape this project and what services they needed in this building. A lot of times, anchor institutions feel like they're removed from the community. So when we started to hear concerns that residents didn't want to see a pill mill, they didn't want to see ambulances in and out 24 hours a day, they wanted to have access to real concrete day-to-day services, knowing that the building could be shaped to accommodate those needs and those preferences helped to make people more comfortable with the project. And as you see what's going on across the street with the PSC&G site, and you see what's happening here with this building, you're seeing responses to community needs at the grassroots level that are going to help to elevate everyone in this community for years to come. And as we're looking today, we're in the agency's 40th year. Seeing these kinds of partnerships blossoming around the state, from St. Joseph's and Barclay Street in Patterson to here to University Hospital. We're working in Trenton, we're working in Camden, we're looking at projects potentially in Atlantic City. This is an idea that is blossoming, and this is the proof of concept. This shows people what can be accomplished when you bring all of those partners to the table and make something really beautiful. So we're so proud to be able to invest $6 million in financing for the University Hospital project to bring tax credits to bear, and look forward to partnering with you in the success of this building today and in the future. Thank you.
Thank you, thank you. Next up, we're going to have Brick City's finest, the mayor, Ras Baraka.
Thank you, I appreciate that. Brick City's finest. Get a shirt that say that. Thank you. First, I want to thank Senator Ruiz, Assemblywoman Pinto Marin for being here and the work that they do to make projects like this a reality for us in Newark. Obviously, Melanie, NJH, HMFA, and for getting it. You absolutely positively get it, and we appreciate that. And the investments that you continuously make in the city of Newark are incredibly important to us. This kind of project is something that I think should be a model across the state of New Jersey, particularly the public-private kind of relationship, and bringing healthcare into housing is incredibly important. We know those are two kind of things that are missing in our community, these kind of social determinants that are creating short lifespans for folks in our community because they don't have access to this stuff. And I know Ketlin knows a lot about that, our healthcare director here, department director in the city of Newark, who have been trying to bring healthcare to residents through mobile vans, through opening up clinics of their own. And what it means is that obviously we have to figure out a way to bring healthcare to people and not just use the hospital, which is driving up costs. I'm glad the University Hospital, and I've had several conversations about his commitment and work around the city of Newark and what they're interested in making happen. We appreciate that for sure. Making sure we provide healthcare opportunity and service directly to the people in this community is enormous. This neighborhood, Georgia King Village, and the folks around this Westward community need access to quality healthcare, need access to immediate care, particularly since there's no primary care physicians in this community. I grew up on Clinton Avenue and 10th Street. My mother still lives there, but our dentist lived on that block. Right there, Dr. Crooms, a doctor was around the corner on 11th Street. That doesn't exist anymore in our community. That was many, 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 many decades ago. And so because those primary care physicians are gone, clinics become that much more important for us. And on top of that, you have housing here, which is also some availability for folks that are unhoused. Some people that are sleeping on the street have an opportunity now to have a place to go, which is becoming a national and international crisis around the globe. So we're dealing with multiple issues all at the same time, which makes this an incredible project here, and I'm glad to be a part of what's going on. Good that we're cutting the ribbon, and I understand people have been coming to this clinic already. It's been opened up a week. No advertisement, no commercials, no anything before the ribbon cutting. People are showing up, which proves that healthcare is necessary. It is needed in these communities. People see a place, a doctor's office, they need support, they're going to come in. They've been doing it already. So congratulations to all of the folks that are involved in this. And hopefully when we start doing outreach, we get more and more and more people, and we can get the government, the state government, and city folks together to do more projects like this in Newark. If they don't want them anywhere else, we'll take them in Newark, that's for sure. So we're glad to have you guys, and we're glad to do the groundbreaking for this today. What a ribbon cutting for this today. Thank you.
Thank you, Mayor. Like he said, we'll gladly take your money. I did say that this was the first, which means there could be a second and a third. Hint, hint. So next up, we're going to bring up our state senator, Teresa Ruiz.
Good morning, everyone. So the mayor keenly said it, right? This is a collective that's happening here. And for me, it's kind of a little bit of a homecoming. And of course, I had to see her out of the corner of my eye. I didn't think you were here today. The last time we were here cutting ground, the lieutenant governor was with us on site, and it was a beautiful day. And the topic that we were discussing, all Newark girls talking about having accessibility right here at home. And so legacy matters. Her work today when we cut the ribbon is true to her testament in leadership and her years of service. So I would be remiss if I didn't take an opportunity to mention that. University Hospital, from its inception, has had a commitment to this city that, quite frankly, I'll be honest, has never been completed. There were agreements that offered multi-layered variables that were supposed to sustain, respect, implement, and forge new opportunities for our families. Today, we're beginning to see those promises in a tangible way. And the state has been a partner alongside in this on many different endeavors, where they're tax credits. But what I'm super proud of is that in this budget, District 29 representative leadership, we were able to secure some funding to continue what will be a new hospital facility, I hope, in my lifetime. We deserve it here in Essex County, we deserve it in the state, and most importantly, my families and children deserve spaces that are filled with respect. The fact that a woman comes into our facility and cannot shower after giving birth is not a legacy that we want to uphold. It is not something that we want to teach our daughters. It is what we're teaching today, that a collective consciousness, regardless as to bureaucracy, regardless as to no's, regardless as to obstacles that are put in place, that we can and we must do better. So congratulations to the administration. Congratulations to the mayor, who's fundamentally always understood, look, there isn't going to be one quick fix to anything. Whether you're elected, have a title or not, it has to be a collective that's going to transform our communities. We are in pockets of area where you can't get access to a pediatrician or an OBGYN or mental health services. The fact that we know it and we're not investing and leaning more into those spaces is crazy to me sometimes, but government sometimes loses common sense. What I'm telling you is that you have the right people in the room at the right time to be sure that our families have access to health, because that is an equity measure. That is a civil rights discussion. That is something that everyone in this world is entitled to. So congratulations.
Thank you, thank you. Next up, we're going to have Assemblywoman Eliana.
Thank you. So I know the majority leader just came up and spoke about, what we were privileged to do in this budget to bring to UH. But, what I'm the most content about is having projects like this that really has a mix view of, housing, and also making sure that we have the health component as well. And I'm going to be honest, right? And I think we see this. My parents are getting to that age where it's necessary to go to doctor's visits, and they will not go if you do not schedule their appointments all in one day or within the first 2 weeks. They're not going, and this is so critical and important. We have Georgia King Village right here. We have all of these residents that instead of having to take, it doesn't seem like that's far, but I know with my parents just having to take a walk a couple of blocks to the doctor's office, it's a big deal. So if you're close and you're offering health services to the community that's right here, and on top of that, having housing opportunities, that are brand new, that are livable, that have equity, that's something that I think we should all be proud of today. So congratulations to the administration today. Congratulations to all those involved. And as the mayor said, what we do here should really be replicated in another spot. Thank you.
I agree with the replication. We got the East Ward, we got the South Ward, we got the North Ward. We're ready. University Hospital is ready. So last but not least, we're going to bring up, I'm going to call him our partner in crime. We started this journey, this train ride many years ago, but we had an actual train ride, the wellness tour of the West Ward. We started in February, not knowing when and if this space would open. So here it is, the final stop, Councilman Kelly.
Good morning. Is it still morning yet? I'm excited. You know, first I just want to say thank you all for being here in the West Ward and in our great city of Newark, New Jersey. Thank you to University Hospital, our partners. It feels good to say that, partnering, right? You know, growing up in the city of Newark, born and raised in the West Ward, I was born at University Hospital when it was called Martland, right? And now to be able to govern in the West Ward and to be a part of this journey, to be a part of this health journey is amazing for me because I'm getting older. My mother, my parents are getting older. You know, the people in my family are getting older. And sometimes I just had my mother has lupus. I'll share a personal story with you. My mother has lupus and she just got diagnosed 2 years ago, but she's just starting to have flare-ups now. So we had to take her to the emergency room, University Hospital, for 2 days in a row. And when you have health centers like this in your community, you don't always have to clog up the emergency room. You don't always have to jump on public transportation if you don't have transportation yourself. You can just walk in your neighborhood. So this, for Georgia King Village, for this district, for this area, you can literally come here and get service that you need instead of clogging up the emergency room, instead of going to University Hospital, you can come right here and get those same services. Since I've been elected, it's been two years since July 1st, and this was one of my goals. This was one of my goals to be part of partnering with people to put health centers in our community that's accessible to all of our residents. Whether you have insurance or not, it's accessible to our community. So I just want to say thank you to Brooke Tippins. I want to say thank you to Newark City, our health department. I'll see our director here who does an amazing job in our city, to all of the partners, all of the doctors, to the amazing tour that they sent me on, that this facility is amazing. I see we have a district leader here from the Georgia King Village. This, Ms. G, this center is amazing. I know you fight for GKV for a lot of great things. Well, this is one thing that is great for GKV and just the entire city of Newark. And with that being said, I get to do this, right? I get to come up here as councilman of the West Ward and give this on behalf of my council colleagues in the great city of Newark, New Jersey, this commending resolution to University Hospital, you know, to the hospital that I owe so much to for giving birth to me when it was Martland. The grand opening of University Hospital, and I would like all of the partners, the doctors, Brooke, come up. You can come up, Brooke. You're one of our partners too. Hey, I didn't see my guy over there. Grand opening of University Hospital Health and Wellness Center. We, the members of the Newark Municipal Council, proudly take this opportunity to congratulate the Board of Directors and the administrative staff, University Hospital, as they celebrate the grand opening of the University Hospital Health and Wellness Center. Y'all can clap for that right there. Open to all residents of Newark and will service everyone's family, the entire family. The governing body joins you in celebrating this joyous milestone once again, and again, congratulations. And I just want to say thank you to all of the dignitaries. I see this beautiful senator here, and I just want to thank you, Senator Teresa Ruiz, and I know the mayor just went to the funeral that I just came from, and you know, rest in peace to Captain Mitchell. You know, Mitch McGuire, we just laid him to rest today, but I just want to say thank you to all of the parties that be to make this happen. Thank you so much.
Thank you, thank you. So this concludes our formal program. We're going to go outside and actually cut the ribbon on our first ever community-based health and wellness center. Give it up for the first. Yes. Yes.
3, 2, 1.